Hi students, today we'll be studying about the anatomy of the neck. This is Dr. Yusuf and these are the specific objectives which are followed in the College of Medicine, Al Jawf University. The first objective is describe fascia of the neck and give their importance. The second one is enumerate the structures in the anterior median plane of the neck from above downwards. Third is mention the actions and nerve supply of sternocleidomastoid muscle, mention its relations and clinical importance. Fourth is outline the triangles of the neck and list the contents of each. Fifth is identify the suprahyoid as well as the infrahyoid muscles and give their actions and nerve supply. So these are some of the objectives which we will discuss one by one. To begin with, if you see the neck is a very important structure through which the lower part of the body will be in connection with the head and neck. So a lot of structures will be entering from the lower part from the thoracic region to the head and neck, and many structures will be descending downwards from the head and neck into the thoracic region, and this connection is very important here, and this is confined to a very small area called as the neck. Before we discuss about the neck itself, we'll be discussing when we reflect the skin and the superficial fascia, there is a very important fascia, deep fascia, called as the deep cervical fascia of the neck, which is also called as the fascia coli. This is the fascia which covers all the structures of the neck and gives an additional support as well as covering. So to define, it is a fascia which invests the muscles of the neck and fills up the interval between muscles, vessels and cervical viscera. So it's a fascia which invests the muscles of the neck. So it covers totally the muscles of the neck, gives protection to that, gives an additional support and fills the interval between muscles, vessels and cervical viscera. So it covers the structures separately, the vessels and the cervical viscera, which are there like the trachea itself, the esophagus, the thyroid gland. All these are covered by a special fascia which is called as the deep cervical fascia of the neck. It has three layers or three parts. One is called as the investing layer of the deep cervical fascia, which is the outermost covering. If you see here in this picture, this is how it looks like. To be more precise, we'll go to the next picture here. If you can see here, this is the cross section of the neck seen from above, and you can see here the blue colored line just below the skin and the platysma muscle. Here there is a deep fascia. This blue line is called as the investing layer of deep cervical fascia. It is covering the whole of the neck as well as it is giving extra support as well as covering to the muscles here, both in the anterior part as well as the posterior part. Here if you see, this is the sternocleidomastoid muscle, behind it is the trapezius muscle. So it covers on either side of these muscles. Okay, so this fascia, which is outermost of the three fascias which cover the whole of the neck, this is the investing layer of deep cervical fascia. The second fascia is called as pretracheal fascia, which is in front of the trachea, so that's why it is called as pretracheal. It can be much more clearly seen in this picture, the cross section, where it is around the trachea. This is the trachea here, and here is the esophagus, and these are the two lobes of the thyroid gland, and around that there is a fascia which is covering. This is called as the pretracheal fascia because it is in front of the trachea, so it is called as pre means front. So pretracheal fascia is the fascia which covers the not only in the front of the trachea, sides as well as behind. Not only the trachea itself but also the thyroid gland, esophagus and other structures. Then the third fascia is there, which is around the vertebra. This is called as the prevertebral because it is in front of the vertebrae. In this picture, if you see here, these are the vertebrae, this is the spinal cord, and in front of that you can see there is a fascia. This is called as the prevertebral fascia. to be more precise, in this picture is much more clear. Here you can see the vertebral column, and this is the spinal cord inside, and around that there are important muscles surrounding this vertebral column itself, and the whole of this structures, the muscles, the vertebra itself, the spinal cord, everything is covered by a additional fascia around all these structures, and this is called as the prevertebral fascia. So it is mentioned here, the prevertebral, this pink line, this is the prevertebral fascia. This orange line, this is the pretracheal fascia, and the outermost is the of the three fascias, this is the investing layer of the cervical. These are the fascias which are around the neck and covering very important structures in the neck. Along with that, there is an additional fascia which covers some very important structure, especially here. If you can see here, this is the fascia, and it covers very important structures like the common carotid artery. So that's why it is called as the carotid sheath, because it covers the common carotid artery as well as its terminal branches, the external and internal carotid artery, especially the external carotid. Then this is the internal jugular vein, and here is the vagus nerve. There are three important structures within this carotid sheath. This is the common carotid artery and its branches, terminal branches. This is the internal jugular vein, and this is the vagus nerve. All these three structures are covered by a special covering. This is called as the carotid sheath. This is also part of the deep cervical fascia. So all these fascia are the part of the deep cervical fascia of the neck, which is also called as the fascia coli. So these fascia will divide the whole of neck into compartment. One is called as the visceral compartment. Viscera means the organs, like the pretracheal as well as the prevertebral fascia, where there are important structures like the trachea, esophagus, thyroid gland, and other structures. So because these fascia, this part of the fascia will be covering important structures there, the organs, viscera, so that's why it is called as this is called as the visceral compartment. So this is the visceral compartment where the important viscera like esophagus, trachea, thyroid gland, and here the vertebral column itself, the spinal cord, the muscles. So all these, the prevertebral and tracheal fascia will be called as the visceral compartment. There is also a very important component. This is called as the neurovascular compartment. Neuro means nerves and vascular means vessels, the arteries and the vein. So this is in case of the carotid sheath, where it is covering very important neurovascular components. Neuro is the nerve, that is the vagus nerve here, and the vascular, that is the artery and the vein, the common carotid artery as well as the internal jugular vein. All these structures are covered by a separate part of the deep cervical fascia. So this will divide this into a separate neurovascular compartment. Okay, so this is called as the neurovascular compartment, inside which the carotid sheath, where the internal carotid artery, the internal jugular vein, and the vagus are present. Why there should be fascia? So some of the important functions of the fascia of the neck have been mentioned here. First of all, it acts as a covering and also as a protective barrier. After the skin, this will act as the second layer of defensive mechanism for any kind of external attack by bacteria, viruses, anything like that. So it acts as a protective barrier as well as it acts as a covering to all the structures in the neck. There are very important structures in the neck, so it has to be covered by extra structures. So this is called as this is the covering of the neck, as well as also it acts as a protective barrier. It gives passage to very important structures, as I said, like the nerves and arteries. If you can see here, it is giving passage from the artery, like the common carotid artery. It is passing from the thorax, and it is going into the head and neck part, and it supplies, it gives the arteries, the branches, two terminal branches, the external carotid artery as well as the internal carotid artery. Internal carotid artery will be one of the two important arteries which will supply the brain, and the external carotid artery will be supplying all the structures in the neck as well as the face. So these are very important structures which are passing from the thorax into the head and neck part. Also the vein The internal jugular vein is draining the head and neck and face and brain back into the thoracic region, as well as the vagus nerve, which is one of the cranial nerve, which is coming from the brain, and it supplies very important structures. It acts as a component of the autonomic nervous system, and it will be supplying not only the heart, the lungs, the GIT, many structures. So this fascia will be an very important. It gives passage for very important structures to move upward and downwards smoothly without any hindrance. The third thing, important feature of this importance of this fascia is, if there is, in case of any infection, then the pus will be confined to that area. If there is some infection here in this component or here somewhere, so it will be confined to that part. It doesn't spread to the all of the neck. So again, as I said, there are very important structures in the neck. So if there is any infection, so it should not spread to other parts. So because of this fascia, the infections and the pus collection will be confined to that particular area, and it prevents the spreading of infection from one part to the other side. If there is any infection here, it will not go to the other side or to here or somewhere else. So this fascia will acts as a barrier from the spread of any infection to any other parts. Fourth is, it gives additional support to the muscles and other structures. If you see here, the sternocleidomastoid or trapezius, they have their own origin and insertion. That is the actually support support of that muscle. But additionally, this fascia will, if you can see here, it is totally covered by this fascia. This fascia splits into two, the anterior layer and posterior layer, and it totally covers this muscle. This is giving an additional support to these muscles and other structures. So here also you can see the carotid sheath is covering these structures, the arteries and the vein and the nerve, and giving an additional support. So this fascia will also act as a very important structure which will give additional support to muscles and other structures. So these are some of the importance of having a fascia in the neck. One, it acts as a covering. Second, it protects acts as a protective barrier and protects from the infection, like any bacteria, virus or something like that. It gives important passage for the important structures like the nerves, arteries and the veins. And if there is any infection, it will be confined to that area and prevents the spread of infection and the pus to other parts. And fourthly, it gives additional support to muscles and other structures. So these are some of the importance of the fascia in the neck. Okay. Welcome back, students. Now we'll be discussing the anatomy of the neck. Before we discuss the boundaries of the neck, we have to know some of the important structures in the midline. So we'll first discuss what are the structures which are in the front, in the midline of the neck. Then we'll talk about the other boundaries. Okay. So the first important boundary is the midline structures of the neck. So we should know the midline structures here, starting from the symphysis mentae up to the manubrium sternum. This is the sternum, and the upper part of the manubrium, this is the manubrium sterni, the upper part of the sternum. So the first structure from the symphysis mentae is a modified raphe connective tissue which extends from the symphysis mentae. This is the base of the mandible, and here is the symphysis mentae. From there, this structure extends. This is a modified tissue, the fibrous tissue which extends from the symphysis mentae up to the hyoid bone. So this is called as the median raphe or fibrous raphe. The next structure, which is the hyoid bone itself, to which this raphe is attached. So this is the hyoid bone here, very small bone which is present in the neck, which is freely mobile. Below that is the a membrane which spreads between the thyroid cartilage and the hyoid bone. So this membrane here, this is called as because it is attached, which is present between the thyroid cartilage and the hyoid bone, so hence it is called as the thyrohyoid membrane. So this is the membrane here, thyrohyoid membrane between the thyroid cartilage and the hyoid bone. So it is called a thyrohyoid membrane. Then below that is the thyroid cartilage itself. We can see the angle of the cartilage. These are the two laminae on either side, and at the center they come and meet, and this is much more prominent in case of male compared to the female. There is much more angulation. This is called as the angle of the thyroid cartilage. This is the angle of the thyroid cartilage and is formed by the fusion of two thyroid laminae. Below that there is one more ligament or the membrane which extends between a cartilage here. This is called a small cartilage, cricoid cartilage, and the thyroid cartilage. So there is a membrane. This is called the cricothyroid membrane, and this membrane is thickened at particular points. So that part will be called the cricothyroid ligament, and outside we have also a muscle, small muscle. This is called the cricothyroid muscle. So here is the cricothyroid membrane which is modified, thickened to form the cricothyroid ligament, and here on either side we have the cricothyroid muscle. Because it is between the cricoid cartilage and thyroid, so that's what is called a cricothyroid membrane ligament as well as the muscles. Okay, below that is the cricoid cartilage itself, and below that we can see a gland here. This is called the thyroid gland, a very important gland which is present here, endocrine gland, which is present in the neck. And below that we can see this is the part of the trachea. These are the tracheal rings, and this is the cervical part of the trachea, and when it goes below, when it descends below, then it will be called the thoracic part of the trachea. So this is the trachea which is extending from the larynx. So this is the windpipe here which is present, which can be seen. So here is the manubrium sternum. So all the structures which are in the midline of the neck, these are called midline structures of the neck, starting from the raphe, the fibrous raphe, then we have the hyoid bone, then we have the thyrohyoid membrane, then we have the thyroid cartilage, angulation of the thyroid cartilage, then we have the cricothyroid membrane and the ligament and the cricothyroid muscle here on either side, and here we can see the cricoid cartilage, and below this is the thyroid gland, and below this is the trachea, which is with the seen can be identified by the tracheal rings. So these are some of the midline structures of the neck. Now we have to also study a muscle, a very important muscle, which is called as the sternocleidomastoid muscle. Okay, this is the muscle, very important muscle, which is present in the neck. So this is said to be the key muscle of the neck because it helps in all the movements of the neck. And this muscle is important because this muscle will divide the whole of the neck into two parts. The part which is anterior to this muscle is the sternocleidomastoid muscle, and the part which is in front of this will be called as the anterior triangle. The part which is behind this will be called as the posterior triangle. So this muscle will divide the neck on either side into an anterior part, anterior triangle, and the posterior part, which is called as the posterior triangle. So if we see the muscle, it has two heads. One is beginning from the sternum, manubrium sternum, this is called as the sternal head, and the other muscle, other part of this, the second head of this muscle, will be beginning from the clavicle. So it is called as, that's why the name sternocleido, and it get inserted to the mastoid process, so hence it is called as sternocleidomastoid muscle. One important thing about the muscles of the neck is they are named according to their origin and insertion. So if you know the name of the muscle, you already know the origin of the muscle as well as the insertion of the muscle. So all the muscles, most of the muscles in the neck are named according to their origin and insertion. So if you know the muscle, the name of the muscle itself, then you know already the origin and insertion. Here it is called as sternocleidomastoid because it begins from the sternum, the origin is from the sternum, then the cleidome is clavicle and get inserted to the mastoid. So it in the name itself indicate the origin and insertion. So here you can see the origin. It begins the origin of one head, sternal head, arises from the manubrium sternum. It is tendinous, and the clavicular head arises from the sternal end of the clavicle. It is fleshy. So it has a tendinous part as well as the fleshy part of the muscle. And the insertion is to the mastoid process, as well as there is a line here extending. This is called as the superior nuchal line. So it get inserted, the sternal head get inserted to the superior nuchal line, and the clavicular head gets inserted to the mastoid process. So this is the origin and insertion of the sternocleidomastoid muscle. Coming to the nerve supply, so this is supplied by an cranial nerve, the 11th cranial nerve, also called as the spinal accessory nerve. This is the accessory nerve. It has a cervical part as well as the spinal part. So this muscle is supplied by the spinal part of accessory nerve. So here in the picture you can see this is the sternocleidomastoid muscle. This nerve which supplies the sternocleidomastoid also supplies a muscle in the back. This big muscle in the back, this is called as the trapezius. So you should remember that the same spinal accessory nerve will be supplying the sternocleidomastoid as well as trapezius. Also some proprioceptive innervation is from the ventral rami of C2 and C3. Proprioceptive innervation means the innervation with which the nerve can sense the position of the muscle. Okay, so whether it is it is contracted or relaxed or something like that, so that sensation is taken up by the proprioceptive innervation. Coming to the actions, if one of the sternocleidomastoid muscle act, there are two on either side, one on each side, so they are paired. So if one muscle only contracts, it flexes the and rotate the face toward the opposite side. When only one muscle contract, it will flex as well as rotate the face toward the opposite side. So this is the origin and this is the insertion. So when it contract, it will pull like this downwards, so the face is turned towards the opposite side. When both the muscles act, at that time there is flexion of both. When both the muscles on either side act, there will be only flexion, and it will be in the center, in the midline. And this is important while getting from the bed. When you get from the bed, the first thing you lift is the head. So this lifting of head is done by the contraction of both the muscles. So it flexes cervical part of the vertebral column and it helps from getting from the bed. So the flexion of the neck is done by contraction of both the muscles. So when one muscle contract, it will flex on one side and it rotate the face towards the opposite. When both the muscle contract, the face will be in the midline, but it will flex in the midline. So this is how the action of the sternocleidomastoid can be explained. Coming to it also helps in deep respiration. During normal respiration, it doesn't actually have much role, but during deep inspiration, when the thoracic cage has to be expanded to a large extent, even this muscle will contract and helps in the expansion of the chest itself. So it helps especially in the deep respiration. Okay, coming to the applied aspect, when the nerve is compressed, this especially the spinal accessory nerve, the nerve which is supplying the sternocleidomastoid, it leads to a condition called as wreck neck. Okay, and if there is total damage to this nerve, spinal accessory nerve, as you know, this nerve is supplying two important muscles of the neck. One is the sternocleidomastoid and the trapezius. So especially during delivery of the newborn, at that time, if a house surgeon or an unexperienced doctor is using the forceps, and if he is during delivery, if he pulls, and this might lead to damage of the spinal accessory nerve, and this leads to a condition called as torticollis. So this is the picture where you can see that the spinal accessory nerve is damaged, which leads to a condition called as torticollis, where the neck is turned towards the opposite side, and the neck is totally on one side, it is flexed to the one side. So this is how it happens. So the damage is on the other side here, where the muscle is not contracting, they are totally relaxed, and these muscles on the opposite side they are contracting. So this leads to a condition where there is flex neck, and there is contraction of the muscle, and it is turning the face towards the opposite side. This is called as torticollis. Now coming to the triangles of the neck. So if you see the neck, it is actually quadrilateral in shape on each side. So this is the whole area of the neck, which almost it looks like a quadrilateral area, and its boundaries we should know before we go to the boundaries of each triangle. So to begin with, as we have seen in the front, we have the midline structures of the neck. This is the anterior boundary of this quadrilateral space of the neck. So this is the anterior boundary, which is formed by the midline structures of the neck, and we have seen what are the midline structures of the neck. Behind we have an important muscle of the back, a large muscle. This is called as the trapezius. This form the anterior border of this trapezius will be forming the posterior boundary of this area. Then above, if you see here, we have the base of the mandible. So this is the base of the mandible, and it is not complete. So it is completed by an imaginary line extending from the angle of the mandible to the mastoid process. So this will complete the superior boundary. So this is the boundary. So here above we have the base of the mandible, and it at the angle of the mandible it continues with an imaginary line drawn from the angle of mandible up to the mastoid process. So this boundary forms the superior boundary, and it also continues behind with the superior nuchal line. You can continue, and below we have the clavicle. So these are the boundary. Anteriorly we have the midline structures of the neck, posteriorly we have the trapezius, and superiorly we have the base of the mandible, and then an imaginary line drawn from the angle of the mandible up to the mastoid process, and below we have the clavicle. So this is the whole area of the neck. So this area is divided, as I said, by the sternocleidomastoid muscle into an anterior part and a posterior part. The anterior area, this again looks like a triangle, so this is called as the anterior triangle, and there is posteriorly we have the posterior triangle. So this sternocleidomastoid muscle will divide this whole of this area into anterior triangle and the posterior triangle. So we'll begin with the posterior triangle, then we'll come to the anterior triangle. So now if you see the posterior triangles, so we should know the boundaries of this posterior triangle first. Okay, so this is the area which is present behind the sternocleidomastoid muscle, and the boundaries are anteriorly we have this muscle. This is called as the sternocleidomastoid muscle. The posterior border of this sternocleidomastoid muscle will form the anterior boundary. Posteriorly we have the trapezius here, so the anterior border of this trapezius will form the posterior boundary, and inferiorly we have the clavicle. So these are some of the boundaries, and the apex of this is the form the base. This is the base of this triangle, and the apex is toward the upper part near the superior nuchal line. So this is the whole triangle. So anteriorly we have the sternocleidomastoid, posteriorly we have the trapezius, and inferiorly we have the clavicle, which form the base. Okay, and the part where the sternocleidomastoid muscle and trapezius meet, this point will be called as the apex of this triangle. So these are the boundaries of the triangle. So whenever you study the triangle, you should know the boundaries, then you should know the contents. Okay, now before you go to the content, this posterior triangle is again divided into two parts by a muscle which is passing down. This is called as the omohyoid muscle. This is the omohyoid muscle which will divide this triangle, this posterior triangle, into a superior part and an inferior part. The superior up part will be called as the occipital triangle. The part which is below this will be called as the supraclavicular triangle, because it is above the clavicle, so it is called as supra. Supra means above the clavicle, so it is called as supraclavicular triangle, or it is also called as subclavian triangle. Why it is called so, I will discuss later. Okay, first we will see the larger triangle in this posterior triangle. This is the occipital triangle. This is the occipital triangle. So now we should know the boundaries of this occipital triangle. They are similar to that of the posterior triangle except few changes. If you can see here, anteriorly we have the sternocleidomastoid muscle. So this is the sternocleidomastoid muscle which is present anteriorly. The posterior border of the sternocleidomastoid will form the anterior boundary. Posteriorly we have the trapezius. This is the trapezius muscle which is there. So the anterior border of this trapezius will form the posterior boundary or behind, and below we have the, as I said, this muscle is called as omohyoid. It has two bellies, a superior belly here, this is called as superior belly, this is the inferior belly. So this inferior belly of the omohyoid will form the base for this triangle. Okay, so this is called as, the name of this triangle is occipital triangle. The boundaries are, anteriorly we have the sternocleidomastoid, posteriorly we have the trapezius, and inferiorly we have this muscle. This is called as the inferior belly of the omohyoid. So what are the contents of this occipital triangle? Very important content of this triangle is the spinal accessory nerve, the 11th cranial nerve. I said this is the nerve which supplies the sternocleidomastoid muscle as well as the trapezius. And if it is damaged, I showed you the picture of the newborn where it has a condition called as torticollis. Okay, so this is the spinal accessory nerve. Along with that, there are also some third and fourth cervical nerves will be coming from here, conveying muscular branches from the cervical plexus. So there will be third and the fourth cervical nerve that also comes from in this triangle. There is also a nerve which is called as the dorsal scapular nerve, which will also come from here. And there are four cutaneous nerves which have been shown here. One is the lesser occipital nerve. Then we have the greater auricular nerve here. So this is the lesser occipital, this is the greater auricular. Then we have the transverse cervical nerve here, and we have the supraclavicular nerves. All these are the supraclavicular nerves. So these are some of the cutaneous nerves which are coming from this triangle. Then there is also the supraclavicular part of the brachial plexus. A part of the brachial plexus also passes through it before it goes into the upper limb and supply the muscles of the upper limb. Then we have at the at this in this area we also have an artery. This is called as the superior cervical artery, and we also have the occipital artery. Occipital artery will be here, somewhere here. You can see this picture where the contents have been shown. Here is the occipital artery which is there along with the greater occipital nerve. Here we can see the superficial cervical artery, also called as the transverse cervical artery, and here you can see part of the brachial plexus. So all these are the contents of the occipital triangle. One of the most important content will be the spinal accessory nerve and the occipital artery and other structures which are shown here. Okay, so these are the content. So whenever we ask you the triangles, you should first of all mention the boundaries. Then the second important structure you have to mention is the contents. Now coming to the second triangle in this posterior triangle, we have seen, what we have seen is the bigger, larger triangle in the posterior triangle, that is called as the occipital. Now we are talking about the small triangle. This is called as the supraclavicular triangle, also called as the subclavian triangle. Even though this triangle looks very small, but it is very important. First of all, we'll see the boundaries, then we go to the contents to know why it is important. First, the boundaries. Anteriorly, if you see here, this is the sternocleidomastoid muscle in the front, and posteriorly we have the inferior belly of the omohyoid, and in below, which is formed by the clavicle, forms the base of this triangle. So anteriorly, in the front we have the sternocleidomastoid, and behind or above we can say this is the inferior belly of omohyoid, and the base which is below will be formed by the clavicle, the middle one third of the clavicle. Okay, so these are the boundaries of this triangle. Coming to the roof, just like all other triangles, this is also covered by the skin, superficial fascia, the platysma muscle, and the investing layer, deep cervical fascia, which you already see. All the structures are superficial, which form the roof. The floor is formed by outer border of the first rib, which is deep inside this triangle, the scalenus medius, as well as the first digitation of the serratus anterior. Coming to the contents of this supraclavicular triangle, one of the very important structure is the third part of the cervical subclavian artery. I said this supraclavicular triangle is also called a subclavian triangle because it has subclavian artery as well as the subclavian vein. These are the main structures. The cervical artery is the main artery of the upper limb, and the subclavian vein. Subclavian artery is the main artery, and the subclavian vein is the main vein which will be draining the whole of the upper limb. So that's why these two structures are one of the most important contents, hence it is called as the subclavian triangle also because of this content. So the name itself indicate that it will have the subclavian artery as well as the subclavian vein. Along with that, there is also the terminal part of the external jugular vein, the superficial vein, which will be draining the head and neck part. So here you can see in this picture the external jugular vein, which will be draining the head and neck. Then the there is very important content here, the trunks of the brachial plexus. If you see here, these are the main content of the main nerves which will supplying the upper limb. This is together they are called as the brachial plexus because they come here and they form a plexus, and then they divide, they become the nerves of the upper limb which will be supplying different parts. Okay, so this plexus of nerves here, they are called as the brachial plexus, and these nerves will give rise to many important nerves, and this can be seen in this triangle. Okay, so this is also a very important major content here. Along with the subclavian artery and the vein, we can see the dorsal scapular nerve, long thoracic nerve to the subclavius, suprascapular nerve, the superficial cervical nerves, suprascapular and dorsal scapular arteries, posterior inferior group of deep cervical lymph nodes. All these contents will be there within this supraclavicular triangle, which is also called as the subclavian triangle. So these are some of the important contents. One is the subclavian artery, the subclavian vein, and part of the brachial plexus, which will be supplying the upper limb. Okay, so these are some of the very important structures which are either going to the upper limb or coming from the upper limb, and these structures are very important content of the upper limb. That's why this triangle is very important, even though it is very small. Now coming to the anterior triangles of the neck. So till now what we discussed is the posterior triangles, which are divided into two parts: the superior, bigger, larger, which is called as occipital, and the smaller, which is called as the supraclavicular or subclavian. Now what we are discussing is the triangle which is in front of the sternocleidomastoid. This is the anterior triangle. Okay. Before we go into the divisions of the anterior triangle, first we will see the boundaries of this triangle. So what are the boundaries? So in the front, so this, if you see here, this is a reverse triangle. So the apex is down and the base is up. So this form the base and this is the apex. So this is a reverse triangle with the apex downwards. Usually the apex should be on the top, but here it is near the manubrium sterni. So what are the boundaries? In the front we have the midline structures of the neck. So these are the midline structures which form the anterior boundary of this triangle. Behind we have the sternocleidomastoid muscle. The anterior border of the sternocleidomastoid will form the posterior boundary of this triangle. And the base is formed by the base of the mandible itself. So this is the base of the mandible, as well as a imaginary line drawn from the angle of the mandible up to the mastoid process. That will form the base. So the boundaries, once again I repeat, anteriorly we have the midline structures of the neck, posteriorly we have the sternocleidomastoid, and the base is which is superiorly placed will be formed by the base of the mandible, as well as the line drawn, imaginary drawn from the angle of the mandible up to the mastoid process. This forms the triangle. Now this anterior triangle is again divided into multiple triangles. these there are four triangles. To be more specific, it is 3.5 triangles which are there within this anterior triangle. Which are those triangles? We'll discuss one by one. The first triangle is called as the muscular triangle. There is a triangle here, this is called as the muscular triangle. The second triangle here, which is called as the carotid triangle. Very important triangle, one of the most important triangles in the neck is the carotid triangle. The third triangle here, there is one more triangle, this is called as the digastric triangle, or it is also called as the submandibular triangle. And in the front there is a triangle which is called as the submental triangle. Submental triangle, half on one side, the other half will be on the other side. Together on either side of the neck, it will join together to form the complete triangle. That's why it is called a half of the triangle. So it becomes 3.5 triangles. So we'll discuss these triangles one by one. To begin with, we'll begin with the muscular triangle, which is in the front, just beside the midline structures of the neck. So the boundaries, as we know, the anterior boundary is formed by the midline structures of the neck, the lower part of the midline structures of the neck. Behind and above, we have this muscle. What is this? This is the superior belly of the omohyoid. So this we studied here. This is also omohyoid. This is the inferior belly. This is called as superior. Superior means above, inferior means below. So this is the inferior belly of the same muscle, and this is the superior belly of the same muscle, that is omohyoid. So behind and above, this will be the boundary, superior belly of omohyoid. Then behind and below on the other side, we have this muscle. This is called as the sternocleidomastoid, the anterior border of the sternocleidomastoid muscle. So these are the boundaries of the muscular triangle. In the front, we have the midline structures of the neck. Behind and above, we have the superior belly of omohyoid. Behind and below, we have the inferior belly of the omohyoid muscle. So these are some of the important contents of this muscular triangle. So what are the these are the boundaries of the triangle, and the contents are, as the name indicates, muscular. So the main contents here will be the muscles, the infrahyoid muscles. So that's why it is called as muscular triangle. Okay, so all the infrahyoid muscles, like the sternohyoid, sternothyroid, all those muscles which you can see in here, so these will form the contents of this triangle. There are no important significant structures here, except if we go deep inside, then we can trace the thyroid, the thyroid gland, as well as the trachea, the esophagus. All the structures can be traced when we go deep inside. Superficially, this is the cross section of the neck. So superficially, if you see after the skin, superficial fascia and other things, you can see the infrahyoid muscle. If we go deep inside, only then we can trace all the structures, the thyroid gland, trachea, esophagus and other structures. So usually it is said to be, it doesn't have significant structures unless we go deep inside. So that's why it is called as the muscular triangle. The second triangle, which is, as I said, one of the most important triangle, is called as the carotid triangle. This is the carotid triangle. So the boundaries, before we go to the contents, we'll go study the boundaries. What are the boundaries? Front and below, we have already studied this muscle. This is muscle is called as the superior belly of the omohyoid. Okay, then we have above, superiorly, front and above. So this is the called as the one more muscle which is called as the digastric. This is called as the posterior belly of digastric. There is also the anterior belly of the digastric. So anterior means in the front, posterior means behind. So the same muscle, just like this muscle, superior, it has the superior belly and inferior belly. This digastric muscle has two bellies. That's why it is called as di means two, digastric. So it has two bellies. So this is the anterior belly and this is the posterior belly. So the boundaries of this triangle, the superiorly, is formed by the posterior belly of the digastric, and behind, this is by the muscle which is called as the sternocleidomastoid muscle. So the anterior border of the sternocleidomastoid will form the posterior border for this triangle. So once again I will repeat, Anterior inferiorly we have this muscle called as the superior belly of the omohyoid, and superiorly we have the posterior belly of the digastric, and behind we have the sternocleidomastoid muscle. So these are the boundaries of this triangle. Whenever it is triangle, it has three boundaries. Always remember, whenever we say triangle, then we should mention that the three boundaries. Okay. Coming to the content, this is, as I said, one of the most important triangle, because we can trace deep inside. If you go, you can see here, these are the structures. This is the carotid artery. So the carotid artery and its two terminal branches, external carotid as well as internal carotid. So these are some of the one of the most important arteries of the neck, because the internal carotid artery doesn't give any branches in the neck, but it will go deep inside and it supplies the one of the two arteries, major arteries, which supply the brain. So this is one of the very important content. The external carotid artery will give a lot of branches, almost 8 branches, and supply the neck, face and scalp, everything. So that's why these are one of the most important content. So that's why it is called as the carotid triangle, because it has the carotid artery, the common carotid artery and its branches. Then along with that, there is, if you can see here, so this is the carotid artery. So it is within the carotid sheath, and we have studied the carotid sheath and its content. So it is one of the content is the carotid artery. The second important content is the jugular vein. This is the internal jugular vein here. Okay, so this is the carotid artery, this is the internal jugular vein, and the third important content of this carotid sheath is the vagus nerve. So very important contents, three important major contents are present here. That's why this triangle is said to be one of the most important. One is the carotid artery, the common carotid and its branches, external and internal. Then we have the internal jugular vein and the vagus nerve. Along with that, there is also, we can trace the spinal accessory nerve and loop of the hypoglossal nerve and the sympathetic cervical sympathetic trunk. So these are some of the important contents of this triangle. The most important will be the common carotid artery and its branches, internal jugular vein and the vagus nerve. Now coming to the third triangle, which is called as the digastric triangle, or it is also called as the submandibular triangle. It is called a submandibular triangle because it is below the mandible. Sub means below, and it is below the mandibles. That's what is called a submandibular triangle. It is also called a submandibular triangle because it has a very important content that is called as the submandibular gland. So that's why it is also called as the submandibular triangle. It is also called as the digastric triangle because of the three, out of the three boundaries of this triangle, two of the boundaries are by the digastric muscle. So here you can see this is the digastric muscle, the anterior belly as well as the posterior belly form two out of three boundaries, two are digastric muscle itself. So that's why it is also called as the digastric triangle. So we'll study the boundaries of this triangle one by one. The first is the base of the triangle. This is also a reverse triangle with the base above and the apex down. So the base is formed by the base of the mandible. So this is the base of the mandible and the line, imaginary line drawn from the angle of the mandible up to the mastoid process. This form the base, and below and anteriorly we have the anterior belly of the digastric, and below and posteriorly we have the posterior belly of the digastric. So this is the anterior belly of the digastric, which is anterior and below, and this is posterior and behind. This is the posterior belly of the digastric. So there are these are the three boundaries. The base is formed by the base of the mandible and the line drawn from the imaginary line drawn from the angle of the mandible up to the mastoid process, and anterior inferiorly we have the anterior belly of digastric, posterior inferiorly we have the posterior belly of digastric. These are the three boundaries. What are the contents? As I said, one of the important content is the submandibular gland itself. Along with that, a part of the parotid gland which is present here also comes here. Then we have important group of lymph nodes here which are called as the submandibular group of lymph nodes. Along with that, there is also the facial artery, one of the branches from the external carotid artery, the facial artery, which passes through this, and a peritouchous artery which comes through this triangle and supply the with multiple branches to different parts of the face. So this is the facial artery, and even the facial vein which will be on the side of this artery will be draining the face. So that is also important content here. Along with the with this, there is also some of the structures like the mylohyoid vessels, nerve, and part of the hypoglossal nerve and the carotid sheath. All this can be also traced here. Coming to the last triangle in this anterior triangle, that is the submental triangle. This is a small triangle which is present in the front, and this is half of the triangle on one side, the other half will be on the other side of the neck. So this will form the half and half together, on either side will join together to form a single triangle. So submental triangle, if you see here, the base of this triangle is formed by the hyoid bone itself, and on either side we have the anterior belly of the digastric here on one side, and the other side will be the other anterior belly of digastric. Together they will form the boundaries. Below we have the base is formed by the hyoid bone, and on either side the anterior belly of digastric of each side will form the apex. So the apex is at the symphysis menti. Coming to the contents, there is not a very important triangle because there are very few contents here. The most important content here will be the submental group of lymph nodes. There are 3 to 4 submental group of lymph nodes which will be draining the tip of the tongue as well as small part of the anterior part of the lower lip. So these are called as the submental group of lymph nodes which are present. Along with, there are also some the anterior jugular vein will be also there. So this is about the triangles of the neck. The posterior triangle and the anterior triangle, which is divided by the sternocleidomastoid. Posterior triangle will have the larger triangle called as the occipital, and below we have the supraclavicular triangle. Anteriorly we have 3.5 triangles: the muscular triangle, the carotid triangle, submandibular triangle, and here there is a small triangle that is called as the submental triangles. Now coming to the muscles of the back. We'll discuss the muscles of the back because there is also a triangle there. This area is called as the suboccipital region, and there are the following muscles will be present in this back superficially. One is the trapezius. This is the muscle which we are discussing since long time. This is the large muscle, the fan-shaped muscle, which is called as trapezius. Deep inside, if we go, we can see the splenius capitis. Then we have the semispinalis capitis here. You can see here. So this is the semispinalis capitis. Then we also have deep inside, if you go, we'll see with the next picture, rectus capitis posterior major, rectus capitis posterior minor, obliquus capitis superior and inferior. All this can be seen from deep. So here if you see deep inside, then we can see this triangle. This is called as the suboccipital triangle. There is a small triangle deep inside, behind and below the occiput. So this is called as the suboccipital triangle. This triangle is present in the posterior part of the neck. So this suboccipital triangle, a pair of triangles situated on either side of the midline in the back of neck. So on either side there is one triangle, so a pair of triangles. The boundaries being superomedially, we have a muscle here. This is called as the rectus capitis posterior major. So this is the small muscle which can be seen here. This is the rectus capitis posterior major which form the superomedial boundary. Superolaterally there is a muscle. This is called as the obliquus capitis superior, and inferiorly we have the obliquus capitis inferior. These three muscles together form the triangle. So superiorly we have the rectus capitis posterior major, and superolaterally we have the obliquus capitis superior, and inferiorly we have the obliquus capitis inferior. These three together will form this small triangle. This is called as the suboccipital triangle. The major content is the third part of the vertebral artery. I said the brain is supplied by two major arteries. One I said is the internal carotid artery. The second artery is the vertebral artery. This is called as vertebral artery because it passes through the vertebrae. In the transverse process there is a foramen in the cervical vertebrae. and this artery will be passing through this vertebrae, 6 out of 7 vertebrae, so that's why it is called as the vertebral artery. And this is also a major artery which supplies the brain. So this is one of the most important content, is the third part of the vertebra. It has 4 parts: first, second, third and fourth part. So this is the third part which will be passing through this triangle. Along with that, there is also the first cervical nerve, which is also called as the suboccipital nerve, which is also coming through this triangle. Along with that, there is suboccipital plexus of veins, which can be traced. So these are some of the important content. The major content will be the third part of the vertebral artery, because this is the one of the two arteries which will be supplying the brain. So this is about the suboccipital triangle boundaries. Students, we now will try to understand the suprahead and infrahead muscles. Suprahead muscles are those muscles which are above the hyoid bone. So if you can see here, this is the hyoid bone which is present in the neck, and the muscles which are above that, those are called as the suprahead muscles. Supra means above the hyoid bone is called as suprahead, and the muscles which are below the hyoid bone, those are called as infrahyoid muscles. Infra means below, infrahyoid, below the hyoid bone. The muscles which are present, they are called as infrahyoid muscles. So suprahyoid muscles above the hyoid bone and infrahyoid muscles below the hyoid bone. So first we will try to understand which are the suprahyoid muscle. The first muscle in the suprahyoid is the digastric muscle. We have already seen the digastric muscle in the neck. So this is the digastric muscle. It has an anterior belly and a posterior belly. So I had told you this is called a digastric because it has two bellies, anterior belly and posterior belly, and the middle part, the tendon part of this muscle, is held in its position by a fascial sling which is coming from the hyoid bone. So that's why this muscle is held in its position by this fascial sling which is coming from the hyoid bone. So this is the anterior belly, this is the posterior belly of the digastric. This is the first muscle of the suprahyoid muscle. The second suprahyoid muscle is the stylohyoid. If you can see here, there is a muscle just beside the posterior belly of digastric. This is called the styloid. It take origin from the styloid process and get inserted to the hyoid bone. That's why it is called as stylohyoid. As I had told you before, most of the muscles of the neck, if you see observe the name itself indicates the origin and insertion of the muscles. So because it takes origin from the styloid process and getting inserted to the hyoid bone, that's why it is called as stylohyoid. The third muscle here is mylohyoid. If you can see here, there is a muscle. Here also you can see in this picture, this is the mylohyoid. Here also you can see this is the mylohyoid. So this is the muscle which take origin from a line here. If you see the medial side of the mandible, if you can see here, there will be a line. This line here is called as the mylohyoid line. So this muscle will be taking origin from this mylohyoid line and get inserted to the hyoid bone. So that's why this is called as the mylohyoid muscle. And the fourth muscle is, it has two parts, the genohyoid. If you see here, this muscle will take origin from the medial side. There are tubercles here called as superior genial tubercles and inferior genial tubercles. So this muscle will take origin from the inferior genial tubercle and get inserted to the hyoid bone. That's why it is called as the genohyoid. The second part of it takes origin from the hyoid bone and get inserted to the some of the fibers from here will take origin from the hyoid bone and get inserted to the tongue. So that's why it is called as the hyoglossus. So it is part of this muscle which together forms the fourth muscle, genohyoid and the hyoglossus. The genohyoid and some of the fibers which take origin from hyoid bone and get inserted to the tongue. So they are called as the hyoglossus. So these are some of the suprahyoid muscles, the four suprahyoid muscles. So there are four suprahyoid muscles and four infrahyoid muscles which you should know. So the suprahyoid muscles are digastric, stylohyoid, mylohyoid and genohyoid with its component which is called as hyoglossus. Now coming to the infrahyoid muscles. Which are the infrahyoid muscles? One is the sternohyoid. So this muscle, as the name indicates, take origin from the manubrium sterni and get inserted to the hyoid bone. So this muscle is called as the sternohyoid, which take origin from the sternum and get inserted to the hyoid bone. The second muscle is the sternothyroid. If you can see beside this sternohyoid, there is one more muscle which take origin from the again from the sternum, but it doesn't go up to the hyoid, but it get inserted to the cartilage here, which is the thyroid cartilage. So it get inserted to the thyroid cartilage. So this is called as the sternothyroid. Sternothyroid takes origin from the sternum and get inserted to the thyroid cartilage. This is the second muscle, sternothyroid. The third muscle is the thyroid, which take origin from the thyroid cartilage and get inserted to the hyoid bone. This small muscle here, this is called as the thyroid. And the fourth muscle is omohyoid. You already seen the omohyoid. So we have the superior belly here. This is the inferior belly, which divides the triangles of the neck. The posterior triangle will be divided by the inferior belly, and the anterior triangles are divided by the superior belly. So this is the omohyoid muscle with the superior belly here, and this is the inferior belly. So these are the four infrahyoid muscles. If you see the nerve supply of all these muscles, the infrahyoid muscles are all supplied by something called as the ansa cervicalis. This is a plexus formed by the ventral rami of C1, C2 and C3. These are the C1, C2 and C3. The ventral rami of this C1, first cervical nerve, second and third cervical nerves will join together and they form a plexus, and this looks like a chain. So this plexus, which is giving branches to all this infrahyoid muscle, this is called as the ansa cervicalis. So you should remember that all the infrahyoid muscles are supplied by ansa cervicalis. Ansa cervicalis is formed by the ventral rami of first, second and third cervical nerves. Okay. Now we'll try to study these muscles one by one in detail. Okay. So the first muscle is the sternohyoid. So the first muscle here, you can see here, this is the sternohyoid. As I said, the name itself indicates the origin insertion. If you see, so this muscle will be taking origin from the sternum and get inserted to the hyoid bone. So this is taking origin from the capsule of the sternoclavicular joint here. Okay, so this is the sternoclavicular joint. Near the joint, it takes origin from both some part from the sternal part and some part from the capsule itself. So this muscle which take origin from the capsular sternoclavicular joint and adjacent part of the manubrium as well as the clavicle and get inserted to the lower border of the hyoid bone. So this muscle is called as the sternohyoid. So the name itself indicates the origin as well as the insertion. The action is, the first action of this muscle is a depressor of the larynx and the hyoid bone and the floor of the mouth. If you can see here, this is the hyoid bone. So when this muscle contracts, because this is the origin and this is the insertion, the origin will be always fixed and the insertion part will be the part which will be moving. So when this muscle contracts, it will pull this bone downwards, this hyoid bone downwards. So it will help in the depression of the hyoid bone as well as depression, because deep inside we have the larynx, so it will depress the larynx also, and when it comes down, it also pulls the suprahyoid muscle, so it pulls even the floor of the oral cavity or the floor of the mouth. So this is the function. So it depresses the larynx, it depresses the hyoid bone as well as it depresses the floor of the oral cavity or mouth. Second thing is when this muscle is stabilized. So this muscle, when this bone is stabilized, because whenever the muscles, suprahyoid muscles are supposed to act, then this bone has to be stabilized. So it also helps in the stabilization of the hyoid bone during depression of the mandible. So whenever these muscles, suprahyoid muscles, are supposed to contract, then this bone becomes the origin for all this muscle. So it has to be fixed. So it has to be fixed so that when the muscle contract, they have to bring the floor of the oral cavity as well as depression of even the mandible. If they want to depress the mandible, bring the mandible down, then this has to be held in its position. So this muscle, infrahead muscles, also helps in the stabilization of the hyoid bone. One is they can bring it down and pull the larynx as well as the oral cavity downwards, or they can also, these infrahead muscles can also fix this hyoid bone in its position, because this hyoid bone is the bone which is floating here. Okay, there is no connection between this bone with the other bones, so it is floating between the muscles, so it has to be fixed so that this the suprahyoid muscles can start acting. So this bone can be stabilized by the infrahead muscles. The third function is the position of the hyoid bone is determined by the myloid and infrahead muscles. So the position of the hyoid bone is determined by the action of these muscles. Either they can bring it down, or they can hold it in its position, or any other position. So these infrahead muscles are very important in the determination of the mylohyoid as well as the infrahead muscles. So this head bone will be stabilized as well as depressed, as well as its position is determined by all these infrared muscles. These are some of the actions of the sternohyoid. Coming to the nerve supply, as I said before, so all the infrahead muscles are supplied by the ansa cervicalis. So the sternohyoid will be supplied by fibers of second and third cervical nerve, again via the ansa cervicalis. So this is about the first infrahead muscle, that is the sternohyoid. Coming to the next muscle, infrahead muscle, that is the sternothyroid. So you can see this is the sternohyoid, and the second muscle is the sternothyroid. So it is shown on the other side because it is deep inside this sternohyoid muscle. So here will be the sternothyroid. So here the sternohyoid has been removed so that you can see the deeper muscle, that is the sternothyroid. So as the name indicates, this muscle will be taking origin from the sternum, the posterior surface of the sternum, and get inserted to the thyroid cartilage. There is a line here on the external surface of the lamina of the cartilage. This is called as the oblique line. So this muscle get inserted on the oblique line of the thyroid cartilage. So this muscle will take origin from the sternum and get inserted to the thyroid cartilage. So that's why it is called as sternothyroid. Coming to the nerve supply, again, as you know, the nerve supply is same for all infrahead muscles, as well as the actions are also same for all the infrahead muscles. So if you remember the nerve supply and action of one muscle, infrahead muscle, you can write it for all the infrahead muscle. So the nerve supply for all these muscles is by the ansa cervicalis. Again, the fibers of second and third cervical nerve will be supplying the sternothyroid, and the actions are also same. One is a depressor of the larynx. When this muscle contract, again it will bring the thyroid cartilage downwards and also pulls the hyoid bone downwards. So it helps in the depression of the hyoid bone as well as the larynx as well as the floor of the oral cavity. Second is it stabilizes the hyoid bone during the action of the suprahyoid muscles. When the suprahyoid muscles are supposed to act and they want to bring the mandible downwards, then at that time this has to be stabilized. So it also, these infrahead muscles also stabilizes the hyoid bone. The third is the position of the hyoid bone is determined by the mylohyoid as well as the infrahead muscles. So this is also a infrahead muscle. So this also determines the position of the hyoid bone. So these are some of the actions of the sternothyroid. The third muscle is the omohyoid. So this is the omohyoid muscle. So this muscle will be taking origin from the inferior belly, will be taking origin from the upper border of the scapula. If you can see here, it has not been shown the scapula. It will be taking origin from the upper border of the scapula near the suprascapular notch. There is a notch on the superior border of the scapula, that is called the suprascapular notch, and this muscle will be taking origin near the suprascapular notch and the ligament. The insertion will be to the hyoid bone. So the origin will be taken from the scapula and the insertion will be to the hyoid bone. So this muscle will be getting inserted to the lower border of the hyoid bone. This is the hyoid bone and this is the lower border. It will be getting inserted to the lower border of the hyoid bone. The superior and inferior belly are attached to each other by the intermediate tendon, which is anchored to the clavicle and manubrium by the fascial sling, just like the digastric muscle. So this is the digastric muscle held in its position by the fascial sling. Similarly, the superior and inferior belly of this muscle are connected to each other by a tendon, and this tendon is held in its position by a fascial sling. Similarly, like here the fascial sling has been shown, here it has not been shown. So there will be also a fascial sling which will be anchored to the clavicle as well as the manubrium. So from here there will be a fascial sling which will be holding the two tendons of the two bellies, the tendon of the two bellies of the omohyoid. Okay, so just like the fascial sling has been shown here, here there will be also a fascial sling. Okay, so this is the omohyoid muscle. The origin is from the scapula and the insertion is into the hyoid bone. Actions are same as that of all the infrahyoid muscle, the three same actions, and the nerve supply is also same, the ansa cervicalis. The superior belly is supplied by the first cervical nerve through the hypoglossal nerve, and the inferior belly from the C2 and C3 through the ansa cervicalis. So this is about the third infrahyoid muscle, and the last infrahyoid muscle is the thyroid, very small muscle which take origin from the thyroid cartilage and get inserted to the hyoid bone. So that's what is called as thyroid. So this muscle will be taking origin from the oblique line. As I told, there will be an oblique line here, so it will be taking origin from the oblique line of the thyroid cartilage and get inserted to the lower border of the greater cornu of the hyoid bone. There are two cornus for the hyoid bone. There will be a lesser cornu and a greater cornu. So this is a greater cornu. So it will be getting inserted to the greater cornu of the hyoid bone. Actions and nerve supply again is same as that of the all other infrahyoid muscles, especially from the C1. So if you can see here, the C1 gate which is mainly supplying the thyroid muscle, the fibers of C1 through the hypoglossal nerve. Okay, so if you can see here, this is the hypoglossal nerve and this is the C1 nerve. It is passing through the hypoglossal nerve and then it innervates this muscle, that is the thyroid. So these are the four infrahyoid muscle. Now we will talk about the suprahyoid muscles. The first muscle is the digastric muscle. So the origin of this muscle is from the posterior belly of the mastoid process. So the posterior belly will be taking origin from the mastoid process. There is a notch there of the temporal bone. So there will be a mastoid notch on the temporal bone. So it will be taking origin from the mastoid notch. This is the posterior belly. What about the anterior belly? It will be taking origin from a depression. If you see from the inside, the inner part of the mandible, there will be small two depressions here. Those are called as the digastric fossa. So the anterior belly will be taking origin from digastric fossa here, from the inside of the mandible, and the posterior belly will be taking origin from the mastoid notch, and both these bellies are connected to each other by a tendon, and this tendon is held in its position, as I said before, by a fascial sling which will be attached to the hyoid bone. The nerve supply is slightly unique here because this muscle is supplied by two nerves. Usually most of the muscles are supplied by the only one nerve, but rarely it will be supplied by two nerves. This is also supplied by the two nerves because the origin of the development of these muscles is different. Even the development of these muscles, the anterior and posterior belly is different, and hence even the nerve supply is different. Coming to the posterior belly is supplied by the facial nerve, and the anterior belly is supplied by the mylohyoid branch of the inferior alveolar nerve, that is the mandibular nerve. So this the posterior belly is supplied by the seventh cranial nerve, and this anterior belly is supplied by the fifth cranial nerve. Why? So that you will study when you study the development. So development is they are different, and hence they are supplied by the depending on the developmental origin. Okay, this is the posterior belly supplied by the facial nerve, and the anterior belly supplied by the mandibular nerve. So what is the actions of these of this muscle? So one is because it is below the mandible, so the main action will be when it acts, when it contracts, it will help in the depression of the mandible itself. So it depresses as well as retracts the chin. So it depresses down as well as it also helps in the retraction of this mandible. The second is if this is stabilized, this mandible is stabilized, then when this muscle contract, it helps in the elevation of the hyoid bone itself. So whenever the mandible is fixed, then it helps in the pulling of the hyoid bone upwards, and this action is especially helpful in deglutition during swallowing of the food particles or something like that. At that time, the elevation of the hyoid bone is necessary at that time. So this muscle will contract and the mandible will be fixed, and this will help in the elevation of the hyoid bone and swallowing. And if this bone is have stabilized hyoid bone with the infrared muscle, we have studied that this bone is stabilized by the infrared muscle, then it helps in the depression of the mandible as well as retraction of the mandible. So these are some of the actions of this muscle called as the digastric. Here also you can see this is the anterior belly, which is taking origin from small fossa here, which is called as the digastric fossa, and this is the posterior belly, which is taking origin from the mastoid notch. The second muscle here is the stylohyoid muscle. So this is the stylohyoid muscle, which as the name indicates, it takes origin from the styloid process. This is called as the styloid process. This takes origin from the middle part of the styloid process and get inserted to the junction of body and greater corner of the hyoid bone. So there is a part where there is junction of the body, this is the body, and the greater corner is this one. So at that particular point, this muscle will get inserted. So this is the body and this is the greater corner. So at the point where these two parts will meet, that part will be the point for the insertion of this muscle. So this muscle will take origin from the styloid process, get inserted to the hyoid bone. That's what is called as the stylohyoid. The nerve supply is same as that of the posterior belly of the digastric, that is the facial nerve. Okay, so this is also supplied by the facial nerve. Here I have shown you that developmentally it develops on the second pharyngeal arch, so that's why it is supplied by the second by the facial nerve. That you will study what are these exactly during the development. At the time you will come to know. So this both the posterior belly as well as the stylohyoid muscle is supplied by the facial nerve. Action, what are the actions? It draws the hyoid bone upwards. So whenever this anyhow this is stabilized already, so whenever this muscle contract, then it helps in the elevation of the hyoid bone upwards as well as even backwards, and elongates the floor of the mouth. So whenever this muscle stylohyoid muscle contract, so because this is the insertion point, so it elevates the hyoid bone as well as pulls it backwards, and that helps in the especially in the elongation of the floor of the oral cavity of the mouth. Okay, here also you can see this is the stylohyoid taking origin from the styloid process. It is not seen, but you can see the insertion of this muscle here. Okay, so this is the stylohyoid. The next muscle is the mylohyoid. So this is the mylohyoid muscle here. as I said, this will be taking origin from the mylohyoid line and get inserted to the body of the hyoid bone as well as the median raphe. This is the median raphe which we discussed when we discussed the midline structures. So the point where the two sides of the mylohyoid muscle will meet, so there is a thin raphe here. This is called as the median raphe. So this muscle will be taking origin from the mylohyoid line and getting inserted to the hyoid bone especially, and also it meets the other side of the muscle at this median raphe. This is the median fibrous raphe. Okay, the nerve supply is supplied by a nerve called as the mylohyoid branch or the mylohyoid nerve, which is a branch of the inferior alveolar nerve. So this muscle is supplied by the nerve of the this muscle that is called as the mylohyoid nerve or the mylohyoid branch of the inferior alveolar nerve. Coming to the actions, so whenever this muscle contract, it helps in the elevation of the floor of the oral cavity. So whenever the two sides of the muscle contract, it helps in the elevation of the floor of the oral cavity itself and the tongue, thus helping again deglutition during swallowing. So whenever you want to, after chewing, when you try to swallow, at that time the whole of the oral cavity will try to move towards the roof. So at that time this the floor of the oral cavity is lifted by the by this mylohyoid muscle. So there is an important point to be noted that when the two muscles, mylohyoid muscles together, they meet at this median raphe, they form a gutter, especially in the floor of the mouth, and this and support of the tongue, and hence called as the diaphragmatic oris. This muscle which form the floor of the oral cavity, and this depression, there will be a depression at this point, and this form the gutter of the floor of the oral cavity, and because it gives support to the tongue, so that's what is called as the diaphragmatic oris. Just like the diaphragm of the uh, abdomen, which separates the thoracic cavity from the abdominal cavity, this also acts as a diaphragm, and it forms the floor of the oral cavity, and it separates the suprahyoid from the infrahyoid muscle. So this part, this, because it forms a floor, big floor, so it is called as the diaphragmatic oris. Because it forms the floor of the oral cavity, that's what is called as the diaphragmatic oris. So this is the mylohyoid line you can see here, and it forms the floor of the oral cavity. So this is about the suprahyoid and infrahyoid muscles. So these are my references, and if you have any doubts you can ask me. Okay, thank you.